Hi, my name's Lauren and I'm going to be doing my HEENT video. First, I'm going to scan the room. Okay, so before entering my patient's room, I would check the chart to make sure I have the correct patient and I'm doing the right procedure. Then I would enter my patient's room, introduce myself, then I would provide for privacy, wash my hands, and do 2 patient identifiers, and I would be looking at the wristband. Can you tell me your name and date of birth?
Amanda Jelinek, 8/16/91.
And what brings you in today?
A checkup?
Are you in any pain?
No.
Are you on any medications right now?
No.
Any allergies?
No.
Okay. So I'm going to start out with my cranial nerves. So for the first cranial nerve would be sense of smell. For that, I would do a smell test. For example, I could put some coffee under her nose, tell her to close her eyes, and ask me what it is that she's smelling. Number 2, I would use the Snellen chart if she complained of any issues with vision. Do you have any issues with vision or anything?
No.
Okay. So next, I'm gonna do cranial nerves 3, 4, and 6. So with that, I'm gonna do the 6 cardinal gazes. So just follow my pen without moving your head. Okay, and her eyes appeared to follow that in a straight line. There's no stigmatist. And then next I would do cranial nerve number 5. For that, I would palpate TMJ. I'm going to have you open and shut your mouth. And there was no clicking. Next, I'm going to do touch sensation. So I'm going to have you close your eyes. And I'm going to have her describe to me what type of touch this is, if it's light, dull, or sharp, and have her tell me where it is that she feels it at.
Light on my left.
Okay.
Light on my left, right cheek. Light on my forehead.
Okay.
Sharp on my left cheek. Sharp on my right cheek. Sharp on my forehead.
Okay. So then next I'm going to do cranial nerve number 7. So I'm going to have you raise your eyebrows, frown, smile, puff your cheeks. Okay, so then that is intact. And then for number 8, I'm going to do the Romberg test. So if I could just have you stand up and close your eyes. So her balance appears to be normal, and then sit back down. And then next I'm going to do the whisper test. Just repeat what I say.
Necklace.
Okay, so her left ear was okay.
Hat.
And her right ear was also okay. So then 9 and 10, if I could have you open your mouth and say ah. Okay. So her soft palate and uvula, they raised midline. Her tongue did not deviate in any way, so cranial nerves 9 and 10 are intact. And then number 11, if you could just raise your shoulders against my resistance. And then your head against my hand. So 11 is intact, and then for 12, if I could have you say light, tight, dynamite.
Light, tight, dynamite.
And 12 is also intact. So next I'm going to start my head assessment. Just looking at her hair, it appears to be evenly distributed. There's no fading, there's no bald spots. And then I'm going to palpate her head. And there doesn't appear to be any masses. I don't see any sores. glass, or her head appears to be normal cephalic, her facial features are symmetric with the size of her face. The hair on her eyebrows evenly distributed as well as her eyelashes. So then next I'm going to do Perla for my eye exam. And I'm going to gauge her pupils. So her left pupil right now is about a 4. And the right pupil is also a 4. I'm going to have you look at a faraway object, and then I'm going to put my pen out here and then just focus on my pen coming in. Okay, and her pupils accommodated appropriately. So next I'm going to check for constriction with light by shining it into one eye. So both of her pupils constricted with my light. Next I'm going to check for consensual constriction. So by shining my light into her left eye, I noticed that her right pupil also constricted as well. And then same with her left pupil when I shined it in her right eye. Just looking at her eyes, her conjunctiva is pink and moist. Her sclera is white. There is no opacities. There doesn't appear to be any redness or discharge coming out of her eyes. Next, I'm going to do my ear exam. So I would palpate the pinna, palpate the tragus, and then push on the mastoid process if you just turn your head that way. And I'll do that one more time. Okay. And then her ears appear to be in line with the outer canvas of her eye. So then I would, if I had an otoscope, I would be looking to see the eardrum that is a pearly gray color. But right now I'm just going to look through the canal with my pen light. When I looked in her ear, I didn't see any redness, I didn't see any drainage, I didn't see any serenum, nothing abnormal, there were no foreign objects, everything looked okay on that side. Now I'm going to look on the right side, and I'm going to do the same thing with her ear. I'm going to push on the pinna, push on the tragus, and then the mastoid process. Did you have any pain when I did any of that? Okay. Then I'm going to look into that ear. Everything looks normal in that ear, no redness, no drainage, no foreign objects. Then I'm going to move on and palpate her sinuses. And first I'm going to do the frontal sinuses. Do you have any pain? Can you describe the feeling? Just light pressure. And then the maxillary sinuses. Any? Okay. And then I'm going to do the temporal artery. And that would be about 2+ for that. Next, I'm going to do my nose exam. I'm just going to tilt your head back. So now I'm going to check the patency by plugging each nostril. The right side appears to be patent. And the left side appears to be patent. There's no deviation in the septum. And now I'm just going to inspect the nares in general. there's no foreign objects, there's no redness, there doesn't appear to be any drainage. Everything looks okay with that. Her nose is symmetric with her face. Next I'm going to do my mouth exam. I just have you open and say ah. So inspecting the mouth, I don't see any sores, any lesions. Her tonsils are, keep your tongue down just a little bit, are about a 1+, I would say. Her teeth are intact, her gums are pink, her buccal mucosa is moist and pink as well. No sores, no lesions, her teeth are intact. Her lips don't appear to be dry or cracked, there's no sores or lesions on her lips. Then next I'm going to move on to my lymph nodes. So for those, do preauricular, postauricular, occipital. I'll not be able to turn around. Occipital, tonsillar, turn back around, sorry. Submandibular. My hands are just kind of going in a circular motion. And then submental. Then supraclavicular. I'm going to have you turn your head sideways. And that's my superficial cervical. Posterior cervical are going to be back here. And then the deep cervical, I'm going to feel right here and kind of move the muscle to feel those. And then while I'm back here, I'm going to do her thyroid, which I'm going to feel right here. If you could swallow for me. Okay. And her thyroid feels normal. I don't feel any bulging, any masses, or anything abnormal. Then for my neuro exam, I'm noting that her body posture is erect. Her mood appears to be calm and pleasant. And then could you tell me where you're at?
At Lauren's house.
And what's the date?
Today is Monday, October 8th, 2018.
And who's the president?
Trump.
So she's alert and oriented ×3. She's dressed appropriately for the weather. And then I am going to do the heel to shin test. So I'm going to have you stand up and then take your right leg and bring it up like this and then put it back down. And then other leg. So her coordination appears to be appropriate. You can go ahead and sit down. And then I'm going to do the Babinski reflex test on her foot. So I'm going to take my pen starting at her heel, go up to her small toe, and around to her big toe. And there was no movement, so that is a negative test, which is a good thing. And then I'm going to assess her gait, so if I could just have you get up and walk towards the camera and back. And her gait appears to be steady. Next I'm going to do range of motion, so if I could have you, I'm going to do abduction and adduction of the arm. So if you want to take your arm out, and that would be abduction, take it back in is adduction. And then do a circular motion, so that would be circumduction. And then now we're going to do her legs and feet. You could just stand up. And then I'm gonna have you take your leg out and in, so that was abduction, then bring it in as adduction. And then go ahead and sit back down and we'll do your feet. And then if you could just put your foot up so they can see. And then do inversion and then eversion. And did you have any pain when you did any of this?
No.
No? Okay. So then I would assess the musculoskeletal system by asking her a couple questions. Do you have any joint pain or swelling?
No.
Do you have any issues with just doing normal activities, any limitations or anything?
No.
Okay. And then I'm just going to kind of palpate some of her joints just to make sure there's no swelling. So I'm going to do her wrist. Those appear to be fine. And then I'm going to do your ankles. Those appear to be fine. Then I'm going to test her strength. So I'm going to grasp my fingers. Okay, that appears to be normal, strong. And then I'm going to have you push my hands. Okay, and then pull my hands toward you. Okay, and then I'm going to do the same thing with her feet, if you want to just put both your feet up. And then push down like gas pedal. Okay, and then try to resist me pushing. Okay, so her strength was strong in that way. So next I'm going to do my subjective data. So, have you had any issues with any hair loss, or have you noticed any issues with your hair?
No.
Have you ever had a severe head injury?
No.
Do you get frequent headaches?
No.
Have you ever had a sudden loss of consciousness?
No.
No? Okay. And then before I continue that, I'm going to do my skin assessment. So just looking at her skin, it appears to be appropriate for her ethnicity. It is warm to the touch. I'm using the backside of my hand. There's no moisture, it's dry, pink undertones. She has a tattoo on her wrist, just a couple normal sized macules, no acne, or I don't see any lesions or any sores. Do you get acne, or do you have any issues with your skin? Have you ever had like a rash or anything? Okay. And then for your eyes, do you have like any allergies? Do your eyes get irritated?
No.
Do you have any dryness, watery eyes, redness?
No.
Any vision problems?
No.
Okay. Do you ever have blurry vision, like when you're reading or driving?
No.
Okay. And then for her ears, do you get frequent ear infections?
No.
Do you ever notice any pain or any excessive drainage?
No.
Okay. Do you have any hearing issues, or have you ever?
No.
Okay. And then for her nose, do you get frequent upper respiratory infections?
No.
Do you get runny nose, dry nose, bloody noses?
No.
No? Okay. And then for your mouth, do you get mouth sores?
No.
Okay. Do you have any issues swallowing, talking, anything like that?
No.
Okay. And when was the last time you saw the dentist?
3 months ago.
Okay. Any bleeding gums?
No.
No? Okay. Do you have any neck pain?
No.
Have you noticed any masses or lumps around your neck area, or any pain with movement?
No.
Okay. Any pain anywhere else with anything upon movement? Wrists, ankles, hands?
No.
Nope. Okay. And you haven't had any major surgeries?
No.
Alright. So everything appears to be normal with my assessment. Before I leave the room, I would make sure my patient is comfortable she has her call light, she has non-slip footwear on, and her bed position is low and safe. And then I would go document my assessment.